The presence of the Delta variant of COVID-19 on the island has increased not only the number of cases being reported, but also deaths associated with the virus. And what's worse, the hospitals have been put under extreme strain due to the number of Jamaicans seeking treatment for the disease. You can protect yourself, your family, and your loved ones from severe illness by taking the COVID-19 vaccine. Vaccines are available for persons aged 12 years and older. Be sure to visit the Ministry of Health and Wellness website to locate a vaccination site nearby. Let's all play our part. Stay safe, vaccinate.
Encourage those around you who have not gotten their vaccine to get it. We all need to be protected for each of us to feel protected. It's a one for all for one type of scenario. Don't use the side effects to discourage others. Because I've had the vaccine myself. It is your body building the protection against the virus. And so interpret the side effects as a positive thing. Don't use the side effects to not take the second dose. To achieve the full protection, you need the second dose.
Good day, I'm Stephen McHugh, and this is your JIS News for Monday, August 30, 2021. A shipment of desperately needed bulk oxygen arrived on the island early this morning to shore up supplies at hospitals struggling to meet the demand caused by increased COVID-19 hospitalizations. Minister of Health and Wellness Dr. Christopher Tufton says the shipment was secured and offloaded due to the efforts of the public health team, IGL Limited and Customs. He says Kingston Wharves had to send a special crew of crane operators to unload the ship at 1 o'clock this morning to accommodate distribution to hospitals starting at 4:45 a.m. The welcomed news comes after the Health Ministry confirmed on Sunday that all hospitals were facing low oxygen supply, some even running out and having to be supplemented. Up to Sunday morning, there were 723 hospitalizations for COVID-19, with 67 persons classified as critically ill. On Saturday, August 28, the island recorded 929 new COVID-19 infections and confirmed 21 deaths. The new cases moved the total number of infections to 66,663 since the first case was recorded last year, while the death toll climbed to 1,504. With these stark numbers in mind, the ministry is urging members of the public to get vaccinated against COVID-19. Vaccination appointments can be made online at moh.gov.jm or by calling the Vaccination Call Center at 888-1-LOVE. That's 888-663-5683. Once members of the public have their appointments confirmed, they should visit their vaccination site with their government-issued ID or a letter from the Justice of the Peace. Those due a second dose will also need to take their vaccination card. The Ministry of Health is also urging the public to remain vigilant in their adherence to infection prevention and control measures. These include mask wearing, maintaining physical distance from others, and frequently washing and/or sanitizing hands. Meanwhile, healthcare workers from several private hospitals across the island will be trained to administer COVID-19 vaccines at their facilities. This development follows a meeting with the Health and Wellness Minister, Dr. Christopher Tufton, senior officials from the ministry, and the leadership of the private hospitals. Dr. Tufton says this will help government expand its COVID-19 inoculation drive and meet the target of vaccinating 65% of the population by March 2022. He says the vaccination training seminar is to ensure that the ministry's standards are met and adhered to. The healthcare workers will be trained in cold chain logistics and management, health promotion and education, emergency services, management of vaccination sites, infection prevention and control protocols, and introduction to the COVID-19 vaccines. Over 100 school nurses will also participate in the vaccination training seminar. These nurses will now form part of the cadre of COVID-19 vaccinators who the ministry can utilize as it continues its inoculation drive in schools and communities across the island. Up to Saturday, August 29, over 512,000 doses of COVID-19 vaccines have been administered. In other health news, the Jamaica Injury Surveillance System, JISS, has received $5.2 million worth of equipment, technical support, and training to bolster government's capacity to track injuries arising from violence against women and girls. Spotlight Initiative Jamaica, a joint intervention of the European Union and United Nations Jamaica, made the donation to the Ministry of Health recently. The equipment includes 6 computers, 4 wireless routers, and 2 UPSs. They will be assigned to the accident and emergency departments of the Princess Margaret and Lionel Town hospitals. The Jamaica Injury Surveillance System, JISS, tracks violence-related injuries, accidents and unintentional injuries, suicide attempts, and road traffic crash injuries. Staff at the target hospitals will be trained to support effective collection and management of the data. This newest donation to the Princess Margaret and Lionel Town hospitals increases the number of JISS sites in A&E departments to 11 across the 4 regional health authorities. An additional donation of computers will be made to the Port Antonio Hospital by September. Major growth was recorded in the goods producing and services industries for the April to June 2021 quarter. The services industry increased by 14% over the period, while the goods producing industry saw growth of 7.8%. Top performing sectors are hotels and restaurants, with a 330.7% increase due mainly to a sharp uptick in visitor arrivals. There was a 50% increase for other services and 16.5% for transport, storage, and communication. Construction grew by a little over 18%, and agriculture, forestry, and fisheries up by 10.3%. Director General of the Planning Institute of Jamaica, Dr. Wayne Henry, says growth in agriculture was driven by a 17.6% increase in the category Other Crops. This reflected higher production in 8 of the 9 crop groups.
This performance was due to a rise in hectares reaped and output per hectare reaped. The most significant increases were recorded for potatoes, up 28.3%, vegetables, up 27.8%, and condiments, up 20.2%.
Dr. Henry was speaking at the PIOJ's quarterly press briefing recently. Residents of Standpipe in St. Andrew are now benefiting from a newly renovated sports complex. Situated on the compound of the Church of St. Margaret, it was recently refurbished at a cost of approximately $13 million. The sports complex comes equipped with basketball and netball courts, upgraded bleachers and restrooms, new changing rooms, a viewing gallery, and a refreshment stand. At the recent handover ceremony, Minister of Sport Olivia Grange said the facility would strengthen the community and assist in reducing crime and violence.
It is anticipated that the space will encourage the young people and other members of the community to engage in sports and physical activity to improve their overall health and wellness. And as we all know, sports is a unifying tool, and so it will help to get the community better bonded, working together, competing together.
Funding for the facility was provided by the U.S. Embassy in Jamaica, the United States Agency for International Development, USAID, Musson Foundation, and the Sport Development Foundation, among other public and private sector donors. Musson Foundation has committed an additional $600,000 in continued support to facilitate basketball and netball lessons for youth in the community. And finally, Prime Minister Andrew Holness is among the many Jamaicans expressing deep sadness at the passing of music pioneer and one of the founding fathers of reggae, Rainford Hugh Perry, affectionately known as Lee Scratch Perry. Lee Scratch Perry died on the weekend while under care at the Noel Holmes Hospital. He was 85 years old. The Prime Minister points out that Perry was a pioneer in the development of dub music in the 1970s and would work with many of Jamaica's other musical greats. His unique approach to recording meant that he was responsible for some of the greatest reggae songs, including Dreadlocks in Moonlight, Curly Locks, City Too Hot, and I'm a Madman. Lee Scratch Perry has received several highly and internationally acclaimed awards, such as the 2004 Grammy for Best Reggae Album titled Jamaican E.T. The government of Jamaica also bestowed Perry with the 6th highest national award, the Order of Distinction, Officer Class, in 2012. In paying tribute, Prime Minister Holness says Jamaica has lost the rhythm and soul of a prolific music icon who has inspired many, adding that Lee Scratch Perry was truly one of the most important and creative figures to have come out of the island. The Prime Minister also extended condolences to Perry's family, friends, his musical colleagues, and many supporters across the globe. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
Concerned about uncollected garbage at home? Do you see garbage piling up on the streets? Then report it. Use the National Solid Waste Management Authority's mobile app to report instances of littering, illegal dumping, and uncollected garbage. From anywhere and at any time, be an environment warden by informing the authority of unsightly solid waste. You will be notified when your report has been received by the NSWMA, as well as when the matter is resolved. Download the app from the iOS or Android app stores by typing in NSWMA. Play your part, as Jamaica's beauty is everybody's duty.
Did you know that persons who are suffering from a comorbidity such as hypertension, diabetes, or heart disease are 96 times more likely to develop complications from COVID-19? These persons are also over 100 times more likely to die from the virus. Find out more about your risk in this next feature.
The Heart Foundation of Jamaica, as you all know, is a charitable organization which has been operating in Jamaica for 50 years now. And the Heart Foundation of Jamaica's mission is to reduce the prevalence of cardiovascular disease, that's diseases of the heart and blood vessels, in the Jamaican population. We are particularly interested in COVID-19 at the Heart Foundation of Jamaica, not only because we have been affected by all the economic, financial, social restrictions, but also because COVID-19 seems to have a particular impact in people with heart disease. And even in people who don't have heart disease, there are cardiac complications which develop as a result of COVID-19. One of the mandates of the Heart Foundation of Jamaica, one of the messages that we want to give is this: continue following up your medical conditions, continue screening for heart disease and the risk factors for heart disease.
In terms of the screening, the cost of doing the heart test or the ECG is $2,500. This would include meeting with the registered nurse, having the ECG done. If it's abnormal, it will be read by a cardiologist. It also includes a blood pressure check and the height and the weight check. We would also recommend a blood sugar test, which is $600, a finger prick, you'll get your result in 3 minutes, and a total cholesterol check, $1,200, which also is the same finger prick to your blood sugar check. So in all, maybe about just over $4,000 would give you a full screening. Based on that, we would then refer you, if necessary, to one of our several cardiologists or nutritionists if you need help with your diet.
As with other infectious diseases, the emphasis is on prevention, early detection and isolation, and also management of cases to prevent persons from having serious illness and death. What we have seen is that persons with comorbidities are 96 more times likely to have moderate and severe illnesses, and are over 100 times more likely than persons without chronic illnesses to die. Many have more than one comorbidities, with a combination of cardiovascular disease and diabetes being quite common. The most common comorbidity and risk factor for death is age over 60 years. Our national surveys have shown that a significant portion of our elderly persons have comorbid illnesses, of which cardiovascular disease is the most common. The Ministry of Health and Wellness have therefore prioritized prevention in these groups to prevent or reduce risk of exposure. Hence, the stay at home, wearing your mask, maintain physical distance. The Disaster Risk Management Act pulls these persons out in having the stay at home order for the elderly persons. And of course, regardless of whether you're at home or in the community, you have to maintain the precautions at all times. It is therefore important that these vulnerable groups ensure that they maximize their ability to fight the disease if they should become exposed. And this includes healthy lifestyle choices, exercise, diet, keeping well hydrated, rest and relaxation, but also care for your chronic illness with regular physical examinations, compliance with medication, and timely and appropriate screening are important in order to ensure that you're able to fight the disease if you should become exposed, and of course that you should seek care early. We have sought to increase persons getting continued care by increasing the use of telemedicine, by increasing the length of prescriptions, and by instituting a home delivery for medications for elderly persons.
Today we observe International Whale Shark Day. This endangered marine animal helps to control the plankton population in our oceans. Here in Jamaica, the Wildlife Protection Act provides wide-scale security for our fauna on land and in our waters. Take a look.
There are increasing threats to Jamaica's biological resources, like our plants or animals, due to events like habitat degradation or pollution. And globally, cycles like animal poaching to fuel a thriving fashion industry continues to hover over the idea of sustainable life in the wild. While Jamaica and the rest of the world's ecological challenges of today need innovative solutions, understanding our wildlife, what to protect, the need to protect it, and those mobilized to protect it is one of the biggest starts.
The overall goal for wildlife conservation is really to try and preserve a particular species in its natural environment. So the species that are protected, how do we determine those? Well, Jamaica, again, as an island, has a lot of unique species. So that's one of the first things we look at. What are the things that are unique to Jamaica? What are the things that are endemic? So we're looking at endemic species, not just animals, but also plants. And we are trying to see how we can ensure that we don't lose those species. There are also species whose numbers are very small. They're not necessarily endemic. Some of them are more widespread, but their species in Jamaica are very small, and they may have a higher threat of exploitation. For example, persons are going to try and harvest them, and so we try to put some form of control onto the amount of harvest that is done. So in order to do that, we have to bring those species under the Wildlife Protection Act so we can better regulate these activities.
So how do we necessarily choose which animals fall under the country's Wildlife Protection Act?
Now, how do we choose these? Well, we look at what is native, what is endemic, and then we actually do surveys. We look at what the population numbers are like. We also signatory to several international treaties that actually tell us that certain species that we have on our island are actually endangered, critically endangered on a global scale. And so we have to play our part here in Jamaica to ensure that those species are not lost.
And then there is the issue of domesticated animals, those that are dependent on humans, because over time they have become genetically adopted to live alongside us. But more and more persons are stepping into the wild for new breeds to domesticate. But disturbing that pattern can have implications.
Domesticated animals are really animals that are very dependent on man and very used to habitualize to man. And so we talk about cats and dogs, some pigeons, for example, your rock pigeons, your everyday domestic pigeons. Those are domestic animals. Now, some of our wildlife persons would like to keep as pet. They are not domesticated animals. They are actually wild animals. Our parrots, for example, we have 2 endemic species of parrot, the yellow-billed parrot and the black-billed parrot, and persons would tend to want to keep those as pet. And they are actually protected because their population is low. First off, they're endemic. Their population is very low, and their population is also declining. And so we're trying to protect those species.
From around August to somewhere in September, our bird shooting season is a welcome activity. But even these licensed activities, the National Environment and Planning Agency NEPA is regulating how we protect our endemic species in the wild.
We have hunting season, that is something that is actually regulated. NEPA also declares what are known as game reserves. And game reserves are areas where we do not want any hunting activity to occur. Because annually we have annual game bird hunting season, and so we have game reserves to protect populations, especially breeding populations of these birds, so that they are not overexploited. So game reserves are areas where no one is allowed to hunt, and we actually created a law in such a way that all forest reserves that are managed by Forestry Department are actually, in effect, game reserves as well. So in that sense, NEPA does have a role in forest reserves in ensuring that no hunting occurs within forest reserves.
So, next time you roam our rugged landscape, or pass by the carpet of plants lining the roadways, the thick tangles of bushes, or observe the colony of birds or seemingly baleful mongoose, let's observe without disturbing those patterns of life.
The following is brought to you by the Office of the Prime Minister.
Our children have been out of school for a year and a half. The impact on their education is significant and it will be long-lasting. As a responsible government, we cannot place the education of your children, our children, at risk. There is a ray of hope, and that hope comes in the form of the vaccine.
The proceeding was brought to you by the Office of the Prime Minister.
As we gear up for the resumption of schools, we share how parents and students can make the most of online learning.
It's now been a reality for over a year. In-person learning replaced by online engagement. As the COVID-19 pandemic continues to affect how we interface, students are learning to adapt to this new era of education. Many are coping well, but some simply have not. In today's feature, we will highlight how 12-year-old Thea Nango is helping her schoolmates cope with online learning. Thean is a grade 7 student at the Denby High School in Clarendon. She recently came to the aid of her schoolmates after creating a video to help them cope with virtual classes.
I noticed that some of my students were coping while majority of my students were not coping so well. So I decided to ask the ones who are coping to share their strategy. And Tia Nango was the most outstanding one.
In her roughly 1 minute and 20 seconds video, Thean can be seen outlining to her classmates the steps she takes to prepare for online class.
Well, for me, I prepare for online class by waking up early in the mornings, about 5 a.m. I do my chores, practice proper hygiene, and eat a balanced diet. And I also get ready for my class at 8 a.m.
She then goes further to list 9 tips they can use to have a successful virtual session.
9 tips you can do to have a fun and educational online class. Number 1, practice time management. Number 2, eliminate distractions. Number 3, stay motivated. Number 4, limit social media. Number 5, figure out how you learn your best. Number 6, Hold yourself accountable. Number 7, make the most of online class discussions. Number 8, always be ready for any activity. And last, set a major goal that you want to achieve.
This video was very helpful to my students in particular. I shared it with my students during form time, and I noticed that the students were more open and willing to share the things that they were experiencing. Students are participating a little better, rather that they're interested in participating, they want to assist with completing tasks. So I realized that the students are a little more interested in school.
I feel very happy in myself that I could get to help someone in my classroom to cope with it better.
As a result of her form class's positive response to Thean's video, Miss Blake decided to share it with the school's grade 7 coordinator.
I shared her video. I shared it with the grade coordinator so they can share it in the different grade 7 WhatsApp group. She was very excited about the video. She was like, "This is really good, Miss Blake. This is a great idea." So she shared it with the other students.
The fact that Thean was able to put together such a useful video that is now helping her entire grade came as no surprise to her form teacher and parents, who have always regarded her as a hardworking, responsible, and focused student.
Thean possesses one quality that I think is missing in most students: passion. She's passionate about school, passionate about learning. I can count on Thean if I'm not there to send me a message to say, "Miss, I'm in class and I'm not seeing you." And I'll be like, "Thean, I'm on my way, don't worry. Just a little delay with my internet," because sometimes that happens. Thean is an assistant for monitor for the class. She is very active. She completes her tasks effectively. One of her tasks is to post the names of the students in the WhatsApp group so that the parents can see the names of the students who are present for the day. And she's always on time. I can say so far her grades are in 80 and above. Excellent grades. So she's doing really well in school.
Her father and I are so proud of her, and the whole family feel proud of what she does. So I'm happy and I'm giving God thanks that she will continue to perform.
The aspiring lawyer and soldier has pledged to continue to excel in her studies so that she can further make herself, her parents, and teachers proud.
I want to continue doing well at Denby for my few years ahead, and I wish to help other students at Denby that are coming up in my generation now. And I can't achieve that without studying and my family and friends and the Lord with me.
For Thean, I wish her all the best, and I want to encourage her to continue to work hard and to do her best at all times. For my students, I want to encourage them to follow the tips carefully, continue to do their best, and it doesn't matter the situation, it doesn't matter where they're placed, whether it's online or physical, they can do it.
And this is where we leave you on today's Jamaica Magazine. Be sure to join us again tomorrow right here on this station for another informative show. We'd love to hear from you. Send us an email, jamaicamagazine@gis.gov.jm. Keep up with us on YouTube, Facebook, Twitter, and Instagram. You may also download our mobile app from your smartphone's app store. On behalf of the entire team here at the GIS, I'm Adrian Atkinson. Thank you so much for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.